Hi, my name is Rachel Levins. So for my presentation, I'm going to be talking about atrial fibrillation, which is a condition in the heart of the atria. So we're going to be discussing what is atrial fibrillation causes, some data points, just like statistics. Also, we're going to talk about how it affects exercise response and vice versa, how exercise affects it. Also, we're going to talk about some exercise prescription and some modifications that you can make for different populations. So what is atrial fibrillation? It is an irregular heart rate that is caused by irregular or multiple electrical impulses that occur in the atria of the heart. So during this, it leads to incoordination between the beating of the atria and the ventricles because the atria are not contracting. So the absence of the contraction can reduce cardiac output by 15 to 30%, and this is why often heart rate is seen as so high, because the heart rate is trying to compensate for this decreased output and the reduced stroke volume. So with this also, you see quite a few symptoms, the most often being shortness of breath, lightheadedness, chest pain, and heart palpitations. With the heart palpitations, they're not always felt, but when they are, they can be very painful. This is typically where they feel that triggered sense of, I have chest pain. It's usually from heart palpitations. Some other symptoms that patients will experience are fatigue, dizziness, all over weakness, and most importantly, and sometimes, the reduced ability to exercise. Also, there are a few different types of atrial fibrillation. There's paroxysmal, which is an occasional type of AFib. It occurs, the symptoms last just a few minutes to hours at the most. It's typically brought on by exercise or like higher stress situations. There's also persistent, which is lasting longer than hours. Typically can be a few months. It does need medical attention, and you do have to go through some treatment of cardioversion. Either with electrical or with medications, and I'll talk about that a little bit more in a second. There's also long-standing, which is continuous, lasting longer than 12 months, and then permanent. So permanent, the rhythm, your regular normal sinus rhythm, is never able to be restored. So you are required to have medical intervention to control this rhythm. So with this, you'll see things like medications, pacemakers, different things like that, different interventions. Some causes of atrial fibrillation. So you have irregular electrical activity in the atria, which I already talked about, usually occurring at the SA node. It's not occurring there, or it's occurring all over at the same time. There's many different situations for that. High blood pressure is a risk. Also obesity, increased alcohol or caffeine intake can see AFib. Athletic predispositions. So some athletes who are more highly trained typically have supraventricular tachycardia, and this can actually have them slip into AFib since the rhythms are similar. Also, with some chronic conditions such as hypothyroidism, diabetes, or asthma, you can see AFib there also. So we have some data here. So 2.7 to 6 million people in the United States are diagnosed with atrial fibrillation. I have a chart from the CDC, and you can kind of see how it would look a little similar if you were looking at an obesity rate chart. In the United States, it does occur more on the eastern side of the country and a little more in the southern region. In this, only 2% of people under the age of 65 are diagnosed. It is very rare to have somebody under that age diagnosed with AFib. 9% over the age of 65 are diagnosed. And also, so the longer you live, the greater chance you have of contracting atrial fibrillation. So in this sense, women are more likely to experience since they have a longer life expectancy. Also, African Americans versus Caucasians are less likely to develop atrial fibrillation. So some traditional treatments, we have cardioversion, there's electrical and drug-induced, which is medications. With electrical, it's shock that's delivered to the heart. It's done using paddles or patches placed on the chest. This would look very similar to a defibrillator. In this type of procedure, the patients are sedated, so they feel no pain. And often they're giving antiarrhythmic drugs before and after the procedure. Before is to help make sure that the heart, after the shock, picks up a normal sinus rhythm, and after the procedure, it's to make sure that it maintains that rhythm. With drug cardioversion, this is for something, atrial fibrillation that is less severe. It'll use the same general antiarrhythmic drugs to restore the normal sinus rhythm, and these can come intravenous or oral. And then the same antiarrhythmic drugs would be prescribed after. So some effects on exercise response. So you'll have the decreased cardiac output. Patients also on medications such as beta blockers will see a reduced exercising heart rate. And this might seem alarming because typically with exercise, your heart rate is expected to rise, sometimes substantially. So typically with them, you won't see a great rise in heart rate, but it shouldn't be alarming. This is their normal. Also, with exercise, somebody with atrial fibrillation is going to fatigue, and they're going to fatigue very quickly, especially if they are not, if their cardiovascular or cardiorespiratory fitness level isn't very high. If it's lowered, they're going to feel a lot of fatigue, especially if they try to overexert themselves. And this is just because also they have the reduced cardiac output. Their blood isn't pumping enough, they're not getting enough oxygen to the different parts of their body, in that sense. Also, exercise might induce the patient's atrial fibrillation, and this is again with the paroxysmal AFib. You'll see this, and also in this sense, it's easy. You can have if you have like a symptom tracker on hand, you can kind of write down when you're feeling these symptoms, what caused it. This is good if you haven't gone to the doctor yet, if you haven't been diagnosed, or even if you have been diagnosed, just to know, along with like your progression. If you're progressing, you could say, oh, hey, it's not affecting me as much anymore if you keep a tracker handy. Exercise effects on the condition. You'll see a lot of the same benefits as regular exercise for just on the body in general. You're going to have increased energy, mood, your sense of well-being is going to be greatly increased. Also, you'll have a decreased risk of heart disease and stroke. With stroke, having this decreased risk is very substantial because with AFib, you have pooling of the blood in the heart, and often with pooling of blood, you see clotting, and these clots lead to stroke often. So if you decrease that risk, or if you increase your energy, you're decreasing that risk substantially. Also, you're decreasing your obesity risk factor, which I already kind of touched on, how it's very, its risk factor is very high for AFib. So leading to improved cardiovascular and cardiorespiratory fitness is very important with that. And also you're just increasing your exercise efficiency. and your heart's working less, so you don't probably have as many of these episodes of AFib. So with your exercise prescription, the first thing you want to do is get assessed. You want to go to your doctor, your cardiologist, your exercise physiologist. Typically, if you're with a physician, they're recommending you to a cardiologist, and they're recommending you to an exercise physiologist. Whoever you're able to ask, get assessed by them. Stress testing is a really great assessment. Along with a 12-lead ECG is a great way to see how far can you progress, where your heart rate should be for exercising, for resting. And this is important because you need to get cleared to exercise. If you have this heart disease, this heart condition, you need to know where you're at so you can safely exercise. Also, you should start slow, especially if you're not a trained athlete or if you're not somebody who trains often in the gym. Patients with atrial fibrillation, like I already said, even if you are medicated, you'll fatigue easily. So if you don't have a high training level, you want to build up to it. With this, the American Heart Association recommends 30 minutes of cardiovascular exercise every day. And then the ACSM, the American College of Sports Medicine, recommends 20 to 60 minutes of cardiovascular exercise 3 to 5 times per week. So you can kind of, American Heart Association is easy to remember, 30 minutes every day. But you can kind of almost do the same thing with the ACSM. You can kind of, do 30 minutes one day, 40 minutes the other day. Mix it up. They're generally about the same amount of time per week, though. And this exercise is going to include walking, running, swimming, and there's also, a great deal more of things you can do. You can use a stair climber. You can use an elliptical. Many different forms of cardiovascular exercise that you can do. And here's the symptom tracker that I was talking about before. So you can kind of see it has unusual heartbeats, shortness of breath, lightheadedness. And like I said, even if you already are diagnosed, it's good because as you progress with your exercise, you can say, oh, like I went from always having unusual heartbeats to occasionally to and shortness of breath. Maybe I felt shortness of breath always when I was lying down, and now it's never. So you can kind of track your progress in that way too, as well as your symptoms, which can show you, oh, I'm not getting any better. Maybe I should go back in and see the doctor. Yeah. I have also some exercise modifications and recommendations. So arm ergometers are a great modification if you are not able, like if your lower body, your lower extremities aren't able to be used. And this could be either if, you are in a wheelchair or if you're just not trained enough to be able to do full body exercise yet. Maybe if you are obese and you need something a little less full body just so you can get a good start. We also have the recumbent cycling or elliptical, and those are good if you need something that's less impact. So maybe you can use your lower extremities, but you had a hip replacement or a knee replacement, and you can't use your lower body extremities as much. This is a really good alternative. Also, breaking up exercising times is totally okay. So if you can't maintain a full 30 minutes of medium to moderate intensity exercise, break it up. Do 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes at night. You're not going to receive any less benefits than if you were doing them all at one time. It's all good for you. It's all helpful. And then here I just have some resources, my sites that I got my information from, and some images from Google. Thank you.